My name is Nelson Lazo, and I'm the CEO of Doctors Hospital, part of Baptist Health South Florida. Well, my responsibilities as CEO here at Doctors Hospital is to oversee the day-to-day operations here at Doctors Hospital, and that involves everything. That involves budgeting, strategic vision and alignment, the human resource aspects of this facility, and the employee engagement of this facility, and also my interactions and my work that I do with my physicians. And one of the biggest parts of being the CEO of Doctors Hospital is my community involvement, which I think, being the CEO of Doctors Hospital and being part of the senior leadership for Baptist Health South Florida, there's a certain amount of responsibility to be involved and participate within the community, and I'm very active in that as well. Well, I've been with Baptist Health South Florida 9.5 years. My first 4 years, I was the CEO of Mariners Hospital down in the Florida Keys, down in Tavernier. And back in 2010, I was afforded the opportunity to come to Doctors Hospital. So I've been at Doctors Hospital a little over 5 years, since 2010. But overall, with Baptist Health South Florida, 9.5 years, I am totally blessed to be part of the system. We are the official sports medicine team physician for the Miami Heat, for the Miami Dolphins, for the Florida Panthers of the NHL, for all the FIU teams, including the women's teams. We're very much involved with the Orange Bowl as well. We take care of the teams that come and visit. We also take care of the Miami Open tennis tournament. We take care of the players, and we send physicians and trainers to the event for the whole 2 weeks. And also the Cadillac golf tournament. We are the official healthcare provider for them as well. And one of the things that we do locally that a lot of people don't know, and it's one of the things that we're very proud of, is that we take care of all the Miami-Dade high school teams. So there's 37 high school teams in Miami-Dade. We send physicians and trainers to all the football games during the season, and we do all the physicals, which is 8,000 plus students that come through Doctors Hospital. And we do that at no charge. So this is the thing that we would do for the community, and it's a very important part of what we do. And our physicians in our facility has tremendous passion for taking care of our community, and the aspect of taking care of our young athletes. Florida International University several years back established a medical school, and they and I might be wrong a year or two here. I think they're either in their third or fourth class coming out of that school, and that has become a very nice feeder of primary care for South Florida, and in particularly for Baptist Health South Florida, because we have a partnership with FIU, and our hospitals are used for training ground and rotations for some of these medical students. So it gives us an opportunity when they graduate to say, hey, we like the student, they did very well, we like to keep them and like to bring them on board as part of the Baptist Health Medical Group. We have really, we have 7 if you include the Children's Hospital on the campus of Baptist Hospital on Kendall Drive. But freestanding, we really have 6 hospitals. We have Baptist Hospital, we have South Miami Hospital, we have Doctors Hospital, we have West Kendall Baptist Hospital, which is our newest hospital that we built from the ground up. And we have Homestead Hospital, which is fairly new. It's a replacement hospital for the old Homestead Hospital. And we have the hospital in the Florida Keys, Mariners Hospital, which I was the CEO at the beginning of my career with Baptist Health South Florida. We're a very tight-knit group of CEOs. So we really, and I'm not just saying this because you're interviewing me, the reality of it is that we are a very tight group. We actually get along very well. Our boss is Wayne Bracken. Wayne used to be the CEO at South Miami Hospital, and he was promoted to the chief operating officer of the company about 5-6 years ago. So there's never really any infighting, or there's never any bickering and backstabbing of that nature. But We do overlap in territories. There is no doubt about it. I overlap with South Miami Hospital. I have a little overlap maybe with Baptist, but not as much as South Miami. We do share medical staffs. So there is overlap. There is sharing of medical staffs. And, you know, would I want to have all the docs be here and do their work here? Sure, I would. But the honest truth is the docs, you know, have practices in different facilities, and, you know, they have preferences in terms of, well, you know, which patient wants to go to which hospital, which physician prefers to do surgery at a hospital and not at this one. And there's different services that South Miami does that I don't do, and there's services that I do here that they don't do. So there is sharing of medical staff, and we all don't do the same services. So it does kind of work out for us. Okay. We have a tremendous continuing education program for our staff, and our staff can access that readily, and we encourage that. One of the bases for One Community, One Goal is the educational component. And one of the things that I am very impressed and very proud of is how the academic institutions within this town have come together to form one nucleus to help us with One Community, One Goal. So we've developed a thing called the Academic Leaders Council. So the Academic Leaders Council is composed of the presidents of all the major institutions in town, i.e. FIU, University of Miami, Barry University, St. Thomas, I'm probably missing one or two, Miami-Dade, absolutely, and the Miami-Dade Public Schools. I was in awe when I walked into the first Academic Leaders Council and I saw all these folks sitting in one table talking about one initiative, and the one initiative, One Community, One Goal, and how education is a big part of that component. And they were actually really the spark plug, in my opinion, of the talent development network. So from an academic standpoint, from an educational standpoint, we got all the players. From the industry standpoint, we try to bring everybody in from aviation. We try to bring everybody else we try to bring people from healthcare. We try to bring everybody else from logistics and trade. So we try to bring everybody that we can to the table to talk about the industries that are the focal point, and then from an educational component, we try to bring everybody within this town that has any bearing on education, because education is at the pinnacle of what we're trying to do with One Community, One Goal.